Siamo a Milano per la edizione 2022 di Frontiers Health, probabilmente il più importante appuntamento mondiale per la medicina digitale. Qui sono riunite centinaia di persone che lavorano in aziende farmaceutiche, società che sviluppano software e società che hanno comunque a che fare col mondo digitale in tutte le sue declinazioni. Oggi abbiamo il piacere di avere qui con noi Yacine Hadjiat, a capo di Biogen Digital Health Solution, una divisione di Biogen, l'azienda farmaceutica appunto impegnata nelle neuroscienze, che ha dedicato un'intera divisione proprio alla medicina digitale. Thank you, Yacine, for being with us today.
Thank you for having me.
Yacine, first of all, who you are and what you do within Biogen Digital Health Solutions.
Sure. So I'm the head of the Biogen Digital Health Solution, and Biogen Digital Health is an innovation unit within Biogen Group. So Biogen is a pioneering biotech company in the neuroscience field, and Biogen Digital Health tries to make digital medicine a reality in the field of neuroscience and mirror what Biogen is in the biotechnology in a neurotechnology field.
How many you are? Where are you based?
I'm personally based in Paris. We are about 150 people, talent across the organization, across 3 hubs, Boston, Paris, and Zurich.
Which is the objective of so huge investment of your company in the digital area?
Our vision and mission is really to make digital medicine a reality in the neuroscience field. And we have 4 key pillars and strategic focuses. One, through technology to enable our research and development and data to make personalized medicine as well a reality. The second one is to equip clinicians with technology, tools, and solutions for better care, better monitoring, and interactions with their patients. The third one is to empower the patient for better care outcome. And finally, we also look to adjacencies, for example, digital interventions and digital therapeutics.
Very interesting. Which are the main projects you have already accomplished so far?
So we have about 14 solutions and projects across our portfolio and pipeline. It goes from patient and support program for patient and apps. We have platforms for HCP healthcare professionals education. We have AI-powered research and solutions for imaging in neurology. And as I mentioned, we have other examples and interventions like digital therapeutics. So it goes across a really large, broad spectrum of interventions from support to patient, equipping clinicians, tools for clinicians, all the way to interventions and research applications for technology.
Very good. And we are in Italy. Some of those projects are already working here in our country?
Absolutely, yes. So Italy is a very important country where we do roll out our solutions. I mentioned about 14 solutions overall in our portfolio and pipeline. 6 of them are already existing today in Italy. I can, of course, share a few examples. Clio, which is our MS companion app. Worldwide, we have more than 600,000 users. We have about 60,000 MS patients in Italy using this solution in their daily life for a better life with MS. Another example is Neurodiam, the #1 website for neurologists and education worldwide. It is also available in Italy, and we have over 3,000 healthcare professionals. Those are for clinicians and patients. I can also take other examples that I mentioned in research, evidence generation, and digital biomarkers. One of them being Connectum, a solution that we built in-house for measurement, monitoring, and digital biomarkers that is implemented throughout international clinical studies, but with 3 centers in Italy, 2 of them being in Milan. I can cite another example with MSPT with a similar approach, or Cogeval, a tool for cognitive assessment for MS patients. Those are only a few examples, but just to show that we are concrete and certainly present in Italy.
Very good. And what's next? Here in this meeting, there is a lot of focus regarding digital therapeutics, for example. What do you have in mind in this area?
That's also a concrete investment and project for us today and in the future. So we do invest and partner in digital therapeutic space. We just signed a partnership with MedRhythms, a digital therapeutics company, to develop a digital therapeutic solution in MS. We do expand also our partnership beyond the digital therapeutics, also in research and neuroradiomics, We have signed also a long-term partnership with a French startup company called Panacea to apply AI in neuroimaging, and so on and so forth. I can go on and on, but just to say that BDH is really here to transform the patient lives. Biogen core life science approach to neuroscience through technology. Those are only a few examples that I shared, but certainly more to come.
Very good. Yacine, thank you very much for having shared this information with us. We hope to have you again in our country with new good things to tell to us.
My pleasure. Happy to come back.